What is PMIS? COVID-19 is a respiratory disease, but PMIS, also known as Multisystem Inflammatory Syndrome in children, or MIS-C, affects organs and blood vessels. Please like, comment, share and subscribe. Thank you for your love and support. Unlike COVID-19, PMIS isn't known to be contagious. Symptoms of PMIS are similar to Kawasaki disease, which is characterized by inflamed blood vessels and toxic shock syndrome. These symptoms include fever that lasts more than 5 days and gets higher, severe abdominal pain, vomiting, or diarrhea, bloodshot eyes, skin rash, change in skin color, which can include becoming pale, patchy, or blue, difficulty feeding or too sick to drink, trouble breathing or quick breathing, chest pain or racing heart, confusion, irritability, or lethargy. Dr. Roberta DiBiase, Chief of Infectious Diseases at Children's National Hospital in Washington, D.C., explains the following are also symptoms that should send a red flag to parents. Swelling and redness in the hands and feet. Redness or cracking in the lips or tongue. Swollen lymph nodes in the neck. Kawasaki, toxic shock syndrome, and PMIS. Kawasaki disease leads to artery inflammation and can damage the heart. It's usually found in children under the age of 5 and can be treated if discovered before it causes long-term effects, such as heart damage. Kawasaki disease is the most common cause of heart disease in children. Kawasaki disease shock syndrome (KDSS) trusted source refers to children with the disease who have hypotension or low blood pressure. A bacterial infection causes toxic shock syndrome. It presents with similar symptoms as Kawasaki disease, but the two have different treatments. PMIS is a post-infectious syndrome, so it's not contagious, notes Dr. Charles L. Schlaen, chairman of the Department of Pediatrics at the Stephen and Alexandra Cohen Children's Medical Center in New York. This also means the syndrome develops after COVID-19 has likely passed. The COVID connection. There is a strong association between PMIS and COVID-19 in terms of timing as well as geographical association. Dr. Sam Dominguez and Dr. Sean O'Leary, pediatric infectious disease specialists at Children's Hospital Colorado, told Healthline. There is a suggestive relationship between the two. However, this is a new and evolving situation, and we are continuing to monitor and learn more about it, they said. The number of children experiencing PMIS who also have COVID-19, as well as the fact that many children with PMIS live in areas hard hit by the new coronavirus, was enough to convince Dr. Lauren Henderson, a rheumatologist at Boston Children's, that the two are linked. There is a clear temporal association between PMIS in children and COVID-19, she told Healthline. This new syndrome has occurred at the same time that COVID-19 is circulating widely, which makes it highly likely that the two are related, agrees DiBiase. PMIS diagnosis and treatment. Doctors combine a clinical exam and laboratory studies to diagnose PMIS. Sometimes they'll do radiology-based tests. It is difficult to tell if a child has PMIS just from a fever and rash because many other infections can cause fever and rash, Henderson said. That's why it's important to see a doctor if your child shows symptoms. Schlaen says PMIS is treatable, unlike COVID-19, which isn't directly treatable. Mostly, physicians will treat PMIS with intravenous, IV, immunoglobulin and aspirin. Steroids can be used, too, says Dr. Audrey R. Odom-John, chief of the Division of Pediatric Infectious Diseases at Children's Hospital of Philadelphia. Children with PMIS also usually require support in intensive care units, often to help maintain blood pressure. Catching this early can likely result in better outcomes, Dominguez and O'Leary said. Many children go home and are healthy after treatment. But missed cases have a greater chance of long-term problems for children, Schlaen adds. Often, fevers will resolve the same day as the treatment, and the heart dysfunction typically gets better over several days, and they appear to do very well, John said. Children need to be followed to assess long-term risks, though. If your child shows signs of severe COVID-19 or PMIS, call your doctor. Parents should contact their primary care physician, but if symptoms seem severe, then they should bring their child to the emergency department, DiBiase advised. We don't want parents to panic, DiBiase added. We believe that the vast majority of children will have mild symptoms with this infection, but parents should trust their instincts. If they feel that their child is very ill, they should not delay seeking care with the belief that children cannot get very ill from this infection. While PMIS is very scary, we are learning more about it every day, added Dr. Stephen Horwitz, assistant professor of pediatrics at Rutgers Robert Wood Johnson Medical School. He's currently working with Boston Children's Hospital and the CDC on a national multi-site study to explore PMIS. The overwhelming majority of patients, even the sickest ones, are responding to treatment and recovering, he said. If you got to the end of this video, thumbs up, and please don't forget to like, share, comment your suggestions and thoughts, and subscribe in order to motivate us. Thank you for your love and support.